Welcome everybody to the Astro Pillars podcast. I have a very good friend of mine and fellow practitioner from Northern Queensland, Dr. Loudon Strang. Dr. Loudon is a doctor of ancient Chinese medicine and runs a very busy clinic up in Northern Queensland. He has over 20 years experience in Chinese internal martial arts and Oriental medicine, which he draws upon to help people achieve an understanding of the foundations of health. One of his main focuses in life is teaching people about the methods and ways of achieving long and healthy, peaceful life. Welcome, Loudon. Thank you so much for joining me here today in the my little podcast I've got going on here. And the topic I've chosen today is men's health, but just give us a little bit of a background how you got into Chinese medicine, because it's really interesting. You're in the Navy beforehand. And I remember years ago, you told me how you met this guy who was in the Navy, who introduced you into philosophy, Taoism, things like all these kind of unique subjects. So,
yeah. Hey, Sam, good to see you, mate. Yeah, for
thanks.
sure. Yeah, it's a little bit interesting. I enlisted in the Navy in the submarine squadron straight after high school, basically.
Yeah.
And I grew up, because I grew up in a, like I'd say, a regional Queensland small town. I didn't have much exposure to literature or things like that. But yeah, I did meet a very interesting guy in the military there he was really different to all the most of the other guys there.
Yeah.
He had, Friedrich Nietzsche books, some of the beatniks. So I never had any exposure to that sort of literature before. So he didn't actually, he wasn't into the, like the Chinese or the Oriental stuff.
Oh, okay.
But yeah, that was the thing that started me on that autodidactic sort of path, learning from books and just following it where it took me.
Yeah. So after, you got into those subjects, I guess those philosophy subjects, did that draw you into the Chinese medical realm or the philosophy of Taoism and those kind of subjects?
It definitely was. I can say, looking back on it, it definitely was the initial trigger to start me searching, if you like, for a deeper meaning to life and so forth. So yeah, it was one of the first things, and
fantastic. Well, I just wanted to let's just touch on men's health, because we're both busy practitioners. I guess we call ourselves seasoned practitioners. We've been in the game for a while now. But how would you summarize the state of men's health from your clinical observations over the years? Because I guess in Chinese medicine, there's a lot of emphasis on the gynecological component. It's very well known. There's a lot of fertility clinics.
Yes.
And there's not that much focus on men and men's issues. And we'll touch on the subject of libido as well. But what have you observed in clinic and generally just the state of men's health and how it is today?
Yeah, good question. So I think the state of men's health is definitely influenced by the sort of well-known generalization that men are fairly stoic and tend to try to resolve their problems by themselves and without, not all, but most men try to tough it out, and I have noticed that as a strong pattern clinically. I see mostly, I would say 65% women in my clinic, but obviously those women have fathers and husbands and brothers and so forth. So I'm hearing hearing men's stories a lot. But the state of men's health, I think it's influenced by the fact that the Western concept of health is very different to what we've come to learn, which is the ancient Chinese medicine.
Yeah, absolutely.
Ancient Chinese concept of what health actually is. And so the word that comes to mind for me is longevity. And the idea of longevity is almost foreign to us in the West.
Absolutely.
Yeah. So
yeah, it's interesting you point that out, because that longevity aspect, and like I was saying, I see a lot of men now, more so in clinic than I ever have, which is great, because I'm primarily like you, it's primarily women coming in.
Yes.
But I get a lot more women. But that subject of longevity is just, I think, one of the real strengths of Chinese medicine in terms of health cultivation, isn't it?
Yes, absolutely. It's when you get into the reading of the stories about the historical doctors and teachers and wise men within the Taoist tradition, and women as well too. It's the focus, or the core focus, is longevity, and we also know that the Chinese were a little bit obsessed with this idea of immortality, but I guess that's on a spectrum. The idea of living a long and healthy life
absolutely
is the, I guess, well, they say that that's the foundation of the concept, or the idea that they were a little bit obsessed with in China, about this idea of immortality. And I just preface that by saying that it's more so an idea about higher spiritual concepts that are inherent in life, as opposed to, just these
like
ideas of
unbroken
levitating from the body and so forth.
Absolutely. So clinically, your main methods of treatments were obviously, one is acupuncture, but I know you're interested in the dietetic side of things and the exercise therapy. So talk a little bit about that in terms of just, I guess, of the how you approach your treatment plans and strategies for your patients.
You're right. I do think a lot in terms of when a patient presents, what kind of foods did they grow up eating? What kind of foods do they eat now, and what's their because we look at the food aspect within the Chinese tradition as the daily medicine, and so I do find myself thinking, what kind of foods is the patient sort of eating every day, and what have they eaten for the last 10 years that may have contributed to the situation that they find themselves in now.
And I wanted to ask you too, because I think the main thing to do with men's health is this concept of libido, and that can relate to a lot of things. I mean, I come from I love the ancient Tao take on that, and particularly more of a modern take on, in terms of Wilhelm Reich's work. But this concept of libido, this is so multidimensional. We could talk, massively, and I want to do a separate podcast on this, about that concept. All disease is rooted in the spirit. We'll get to that a bit later on, but a lot of men suffering from these libido problems. And a lot of it's to do with, like I've spoken to you many times over the years in relation to this, in terms of the medications people take. But it's not just that either. There's something going on with men where they just don't have that mojo anymore. They seem to be more, they're softer. And I'm not saying softer in a way that they're weak, but there's
Yeah.
just this whole concept of what's your take on this libido
Yeah,
deficiency, so to speak?
I'd agree with what you said in the
Mm,
beginning there in terms of it being obviously multidimensional, and
mm,
that's the one of the real treasures of Chinese medicine
mm,
diagnosis, is that we have the tools to be able to look into all of those different factors.
mm,
But yeah, in relation to libido, as you alluded to, yeah, the Taoists look at the reproductive function and the essence that powers that as the deep inner reserves of human energy. And
mm.
so um,
Yeah, excellent
yeah,
point, man. Excellent
yeah,
point,
so
because there's
mm,
so many things that really in our Western culture just kill it. I mean, in terms of
that's right.
obviously medications, one,
Mm,
excessive alcoholism, drug use,
yes,
and probably another one of the classic examples as probably how Wilhelm Reich would call it, the emotional plague and psychological armoring
yeah,
that, that a lot of people, which is deeply rooted in trauma
yeah, for
as
sure.
well. Yeah.
Absolutely. And what comes to mind there for me when you were talking about that quote from Reich is
Mm,
getting back to the practical aspect of men. Your average Aussie bloke might drink, a few beers every night, cold beers every night, and
mm,
that in itself is not really considered to be a big issue in our, particularly if it's only just a couple of beers. But
mm,
from our perspective, from our medical perspective, that as men get older, the ability of the body to be able to process that cold temperature input,
mm, mm,
and yeah, and deal with that without it becoming an actual pathogenic or stagnating factor in the body.
mm,
Um, yeah, even something as what the average person might consider to be a relatively normal lifestyle habit can
mm,
actually be a pathogenic factor when it comes to men's libido. And you pointed out that psychological armoring. So
mm,
we might look at, well, why is the individual drawn to have those 2 or 3 beers every night, sort of thing. And
absolutely. Yeah.
yeah, um,
And it's so interesting you mentioned cold
hmm,
and how cold, as we know in Chinese medicine, damages yang.
yeah,
And yang is deeply rooted in libido.
that's right.
Yeah. I
Yeah,
mean, this is how we look at it. It's
yeah,
kidney yang deficiency.
that's right.
Um,
And
I
yeah,
mean, not just that, but primarily that this cold damage that happens and how we, those endless classics of Chinese medicines talking about cold and how it does damage us. And
yes,
it's just completely foreign to us now. I mean, particularly in the
it
West.
is.
Yeah.
Yeah, um, we have a general concept of metabolism in the West, in Western scientific
Mm,
fields and so forth. But yeah, it's very basic, and it doesn't draw the correlations between um, metabolic functioning in relation to hormone functioning and reproductive ability and so forth. So
yeah.
that's the real beauty of Chinese medicine, what it has to offer. And yeah,
Yeah. And that leads us into that concept of the three treasures, doesn't it?
mm, absolutely.
Yeah.
Yeah,
And for those who
yeah,
don't understand this or haven't come across this concept of three treasures in
mm,
Taoism, it's considered Jing, which is your life essence, Qi,
yes, yes.
and my God, I've gone,
And Shen.
and Shen. Yeah,
Mm.
can't believe I blanked out on that one. My
Oh,
God.
that's cool. That's cool. Yeah.
But yeah, Jing, Qi, and Shen.
Yes.
And talk about those for a little bit. I mean, how have you incorporated that in your clinical practice? Because I guess for the serious person who comes in for a consult, I always elaborate on these kind of things. And some people will roll their eyes, but then occasionally you'll get the very serious patient who will take these concepts on board, especially when they've been incredibly ill.
That's right. Yeah,
Mm.
exactly. Yeah, the REN channel points from REN 4 to REN 8 are ones that I choose as sort of go-to points if a male presents with erectile dysfunction. Obviously, I'm going to go into the deeper pathologies of what's actually happening. But if I want to try to achieve a quick result for the person, I'll always potentially choose some of those points on the first treatment. Just sometimes, yeah, needling that channel is all that's required unless it's a very severe case where the person has serious comorbidities and so forth. Those points can just open up the flow into that area, and
Absolutely.
yeah, well, I'd say in cases where the male is generally healthy and not not too elderly, yeah, anywhere from 30s to 60s, yeah, needling those points can often produce a fairly quick result.
Yeah.
Yeah, yeah.
No, very good, very good. And have you found so mainly your approach is the acupuncture, but what about herbs?
Yeah.
Some of your patients open to herbs? Or you
I'd
mainly
say
use the needle?
regional, yeah, in general, regional Queensland males are probably least likely to take herbs. I definitely have experience there clinically in Melbourne, and I think men in the bigger cities probably have a little bit more exposure to the idea of using Chinese herbs. But yeah, I think the topic itself obviously is obviously it's a little bit slightly embarrassing for men to admit that they might have an issue in that area. So
yeah, absolutely. Yeah.
Yeah, so yeah, the answer to your question, generally, I'd see a male that would come in with some other problems. They might have arthritic knees or frozen shoulder or lower back pain or something like that, and they'll mention the libido issue as an aside. And
yeah, absolutely,
yeah,
because the libido can be like the Shen, which is like translated to the spirit, and that's what I was talking about in the Reichian sense of
yes,
psychological armoring.
yes,
It's a lot to do with the heart function. And then you've got the Qi, which can be Qi stagnation. I found a lot,
yes,
particularly in men who are robust. But as soon as you free up that liver, the free flow of energy,
yeah,
it really gets the mojo pumping again, to
yep,
use layman's terms. And then, yeah, obviously the Jing, which is connected to the essence and the kidney
yes,
yang. So those
absolutely,
three components are just incredible, and where there's no space in our culture now in terms of cultivating those treasures. And another thing I didn't mention, which is just ran pretty obvious, is this overworking. Men really do flog themselves, excessive labor, or working really hard, long hours. These all consume Jing in our essence,
right.
and we don't have that space to replenish. There's nothing in our culture that allows us the time to go out and recuperate. And it can be, for some men, it can be an ego thing. They don't want to let go of that ego. I'm a man, I'm in control, I've got to provide, which is fine, because that's an actual masculine trait. But then you also need to become a little bit softer and switch from yang to yin. You've got to know when to tune into these transitions to help cultivate the body.
Absolutely. And yeah, that's such a good point. And I could even make an example of that, which is, you know, the normal malfunction of having I can't the medical terminology has just gone from my mind, but the morning erection
Ah, yep.
is like that is very normal after um, having a full night of restful sleep. So,
Yeah.
so that's just an example of what you were talking about, whereby if men are excessively overworking and not allowing their bodies to recuperate, then yes, it can have yeah, serious effect on their libido and erectile function for sure.
Yeah, absolutely. Adequate rest. And it's a really good point, because I think and I think it was Master Ni. I know you're right into Master Ni in terms of the Taoist take, but I remember
Yeah.
saying, or may have been who was that gentleman who did a lot of the Qigong stuff over in Thailand, you know, yeah. He was saying importantly, like it's natural for men to get an erection during the night, you know, because this is the
Yes,
recuperation of the yang, which
absolutely.
is it's in, yeah. And I think for men who really do have those issues, it's important to rest, and probably the best time to be intimate with the partner is the early hours of the morning,
Yeah,
you
that
know, after you've recuperated and
yes,
replenished.
exactly.
Yeah.
Especially, yeah, especially as men move into the um, middle-aged years. That's for sure. Obviously,
Mm.
um, when when we're young, you know, the function is completely full
Yeah.
due to the youth. But
Mm.
yeah.
Yeah, absolutely.
Mm.
Yeah. So, do you have any other questions? What was there anything else you wanted to talk about in relation to this?
Yeah, I think
Did I
you
cut you off
really
at one point? Sorry
yeah,
about
yeah, man.
that.
Yeah, the three treasures is very. It's such a there's so much that we can tease out from that.
Yeah.
But yes, the Jing or the essence, which we could loosely associate with potentially semen production, but it's not just that.
Mm.
Um,
Yeah.
yeah, the Taoists look at that Jing as being the fuel for the Qi element, which is the middle element, isn't it?
Mm.
And then, so if there's a deficiency in the Jing element through a genetic deficiency or a lifestyle issue,
Mm.
um,
Mm.
that in itself is going to have a flow-on effect to the chi level or the energy level or even the
Mm.
emotional level. Um, and
Mm.
so,
Absolutely.
yeah, so when, I guess what I'm getting at is that the three treasures, the Jing, Qi, and the Shen, or body, mind, and spirit, are interdependent on each other, and Master Ni talks a lot about that. So,
Mm.
um, and you know, we can find parallels with that concept in obviously in yoga and the practice of yoga,
Mm.
because this idea that the all of the human energy, the physical energy, is based in the lower, what the Indians would call the lower chakras or the lower dantian in
Yeah.
Daoism.
Yeah.
Yeah. So point being, if we burn the candle at both ends, we're going to be um, reducing the Jing element, and then so that's going to have a flow-on effect to the Qi and the emotions, and then necessarily onwards to the mental or to the spiritual aspect or the Shen aspect. So
Yeah. Very well
yeah, I think
said.
that's one of what can we say, the benefits of learning about those concepts for the Westerner, because I don't see any other correlations or anyone really speaking about those things apart from, for example, you're into the George Carey, and he has definitely an interesting take on internal alchemy, which is but he makes connections with obviously with the Western spiritual aspect. But it's all there.
It's all there. It's actually I love his work, because when I read a lot of it, and that's why I've been doing this Cell Salt series. But I found reading a lot of his works, and I love reading the Bible stories as well, because of the connection with the body. And I think a lot of what the message is of that book is really how to cultivate ourselves and keep the temple clean, the temple being the body. And this is the same. I've noticed that the salts have the same very, very interesting correlations and in connection with ancient Chinese medicine, in terms of their understanding. Like, calcium phosphate can be that Jing tonic, so to speak. It's exactly what the same kind of metaphors are there, which I found just amazing. Well, maybe we'll do a separate talk on that, because I find the Bible is an absolutely fascinating book when you understand the bodily correlations and the etymology of those words and what it's really all about.
Absolutely, it is. That's for sure.
And so we'll definitely do that at a separate time. I think we'll pick out the subject, because I think that would be really interesting for people. But so I think we'll leave it there, Loudon. Because I think we're around the half-hour mark. So thanks heaps for your time, and we'll do this again. We'll do a follow-up on we can get deeper into men's health, or we can even, like you were saying before when I was speaking to you before, we can actually even touch on women's health as well in relation to this libido function and health cultivation.
Let's do that. Sounds really good.
Thanks a lot for joining me. It's been sensational. Awesome.
Awesome.
Take care, mate.